Hello, can I check? Is that Zoe Walker?
Yes, yeah.
Hello, I'm sorry to be ringing you at this time. I'm Bruce Montgomery. I'm the Deputy Medical Director at Borsetshire General Hospital, and I've received your letter and have read it, and I thought it was really important that I rang you, and I'm just desperately sorry to be ringing you under such
Thank you.
circumstances. Your letter raises a lot of really important points and questions. And I can't imagine what a desperate place you must be in. And it just is so sad. And I'm sorry for that. But I wanted to just hear from you what what you're thinking and what's going on.
I mean, honestly, I don't really know it. I don't really know where to start. You know, I had no idea how completely let down we would be at the one most important moment. Um, I feel a bit lost for words at the moment. I thank you for reading my letter. I do appreciate that. Um, I'm not quite sure where to start.
I'm just going to take some notes as well as we go along, just so I don't forget things. Tell me, tell me about the letdown.
Well, the letdown is that I just feel like every step in the process leading up to Stephen dying was just it just felt like complete chaos. It just felt like nobody was holding it. You know, we were told not to go to hospital because it wasn't safe when he first got the fever, and to treat him with paracetamol. And then by the time we got to hospital, they did test him for COVID, but then they didn't treat him. You know, they didn't. They did nothing for 2 days. They put him on a drip. He had antibiotics. I think he had paracetamol there, but they left it untreated. Although from as far as I can see, it was, you know, it was obviously COVID. When I spoke to Stephen, when he was still in a state when he could speak to me, he said that there were times when people were forgetting to give him food, um, that people weren't changing his water jug. You know, the people that were meant to be taking care of him, he seemed to have just been neglected and left. I mean, every step. There's so many aspects. It's quite hard to know which part and who to be telling you about first. Really, should I be telling you about them giving him options without any kind of involvement with me being part of that conversation? I mean, nothing seems to have been no protocols seem to have been followed, as far as I'm concerned, in a way that you'd normally treat patients and family members.
It sounds as though you're in a desperate situation and want some answers.
I want to know why I wasn't, you know, by the time somebody rang me, the conversations had been had, and he was so sedated. By the time you rang me to tell me that he was dying, all I could do is sit with him and watch it happen.
I'm really sorry that you weren't called when we were having those discussions. That's just not acceptable. And that's something that must happen in future. I can't make this better for you, and I'm really sorry. But I can try and address some of the points that you've raised, which are really important. You've mentioned about the fact that nothing happened when he came into hospital, no active treatment was given. You mentioned that it was chaos on the ward and he didn't get the food he needed and they weren't tidying up. You were called late and weren't involved in discussions about his care. You didn't have a chance to say goodbye. And that's, that's awful.
I have concerns about all of it, you know.
And tell me more about, I know you've mentioned the specifics, but can you expand a bit more on those concerns?
Every step of the way, I feel like you were making decisions based in a chaotic environment, which I don't think had his best interest. I just felt like you know, in the normal scheme of things, you would test somebody and treat them. It was so obvious. But he just got left. His water got left, his food got left, and his symptoms got left until it was too late.
One of the problems with COVID-19 is that there is no specific treatment. Medicine's in a completely unfamiliar place. Normally, we know what to do with most diseases, and we have effective treatments that sometimes work and sometimes don't work. But with this disease, we're in an impossible situation. That doesn't make your situation better, but it's just impossible, because despite what we do, the disease generally takes a course of its own, and acting earlier doesn't make a difference. We don't have anything we can give except to wait until things declare themselves. And that's an awful situation to be in. And it must be, from your perspective, seem like we don't care and we're just not doing anything.
I don't think you don't care. You know, I do know how hard everybody is working, and I do know that this is chaos. But, you know, there were fundamental areas of complete chaos and non-communication which are nothing to do with COVID, and everything to do with the people who were meant to be taking care of my husband. I know it's chaotic.
And that's why I think it's important that I'm having this conversation with you, because learning about how that fell apart, we don't want that to happen to anybody else, and how important that is. And I think at the beginning, there was an element of people behaving like headless chickens, just not coping. And we need to make sure that relatives are involved in conversations with their loved ones.
My last chance, you know, that was it. And I could have been there, but I wasn't, because you didn't bring me.
And we can never give that back to you. And it's just awful. And it's awful.
So what are you going to do?
Going to put in place, speaking to our staff and making sure that they can communicate better, to make sure that they involve those close to a patient in important discussions, because technology means that you can be near someone. So that's something we can make a difference with. I think we need to be more honest about what's going on.
Can you be honest with me now then, and tell me that if you'd have treated his kidney failure, would he have had more time?
Honestly, I don't think he would have. The problem was that his lungs were deteriorating and continuing to do so. I think the kidney failure was just part of how sick he was. And his body was deteriorating all over. He was sadly dying. And treating the kidney failure, I don't think would have given him any longer. I'm really sorry to say that, but I don't think it would have made a difference.
And are you saying that has nothing to do with not having the equipment available?
The clinical decision was that treating his kidney failure would not alter the outcome. And one has to base decisions on the benefit to the patient, and I'm sorry. I'm so sorry.
Everything that I had in front of me is just completely gone. You know, all the plans I had,
for me, for Stephen. We were meant to be having kids. And I couldn't even.
It's just an awful, awful situation. Just awful. If at some stage you felt up to it, might we be able to talk to you again and just use some of your words to play to our staff so they hear how it is? Because I think that's very powerful.
Okay.
Yeah. And the other thing that I just wonder whether it might help, and you can say no, it's just a suggestion, is whether an offer of some bereavement counselling from the hospice on a one-to-one basis might at some stage be welcome.
I'm not sure. I do appreciate the offer, but I'm not really sure at the moment. Can I have a think about that?
And thank you for your honesty, and thank you for raising this, because it's important that we do better.
I have no idea what I'm meant to be doing next.
There isn't a right or wrong answer. I think it's trying to cope. And one thing I might suggest is that I ring you again in a week or so just to check in.
Okay.
And I will make those changes, and then we can talk maybe about doing a little piece to help our staff realise the effect of poor communication and not seeing the perspective of the patient and their relatives and the effect that has.
Okay.
Thank you. And I'm sorry.
Thank you. I do appreciate the call, so thank you.